Welcome to the Dr. East podcast, where we talk all things living your best life. In this episode, I sit down with Dr. Nicole Vane. She is a biological holistic dentist here in Encinitas, California, with over 25 years experience, and this conversation is so good. You may be asking yourself, what is holistic dentistry? That's exactly what we talk about. We talk about fluoride, root canals, hydroxyapatite. Your teeth are little organs, leaky guts, leaky gums, parasites, oh, and so much more. I'm so excited to share this conversation with Dr. Nicole Vane. And I want to open up with probably the question that will start our conversation, and one that I've talked to you about, which is, what makes holistic dentistry? Like, what is it, and how is it different from conventional or the dentistry we're all used to?
Okay, well, it's such a layered and complex question, but I'm going to try and give you a concise answer. So, what makes holistic different is I like the term integrative, or it's the same as a functional medicine doctor, where we have allopathic medicine or traditional ways of doing things, which again, as a dentist, we still will take out teeth, we'll still treat infections, we'll still put in fillings, but it's an overall awareness of one, the materials we're using, what we're putting in the body to make sure it reacts well with that individual. For instance, all biologic dentists are metal free, we're BPA free. We like to use materials that are free of toxins. And even when we're doing surgeries, there's a process of doing that in a way that's very compatible with your biology and using materials that are from you or that are synthetic and non-reactive. That's one component. The second component is understanding that the teeth themselves are organs. There are 32 little organs, each of which is connected to a meridian. So what's going on your top tooth could be contributing to your migraines. It could be contributing to your gut health, to sinus issues, to an imbalance in your craniosacral system. It could affect your big toe on your right side, depending on what meridian it's on. So a lot of holistic dentists have an awareness of how these meridians can be impacted or how they can drain your energy. And the longer I'm in practice, the more profoundly I'm seeing the connections of everything, especially now that I am in an older age. I've now hit 50. So I am in the quote perimenopausal age, and all the symptoms women complain about with just being my age, none of which I have, by the way. Brain fog, I don't feel like myself. A lot of it relates to the mouth. So being holistic, biologic, to me, again, is more integrative. It's understanding how all these things function together, or how one tooth or something going on in your oral microbiome can affect your whole microbiome.
I love
So
that. One thing that like stuck with me just now, and I wrote it down, is your teeth are little organs. I have
they
a background in
are.
Chinese medicine, and we're all about the organs, both
Mm-hmm,
the organ systems, in that they all have to work together. Also,
mm-hmm,
and you and I have talked about this, is that our body is full, just like as above so below, the microcosm in the macrocosm. In Chinese medicine, your ear is an entire map of your whole body, your
mm-hmm,
face, your feet, your hands, and your mouth.
mm-hmm.
And in Chinese medicine, we look at the eyes as the window to the soul. The eyes show us the person's shen, their essence. And so, from a biological dentist, holistic dentist point of view, the mouth is also a window to the
Mm-hmm.
body and the soul. So, can you share how you view the whole macrocosm of
Mm-hmm.
your patient from the microcosm of their mouth?
Yeah. Okay. So back to the teeth or organs. They have their own lymphatic drainage system, their own blood supply, as well as their own nerve that connects back to all the main maxillary nerves, mandibular nerves that drains downward, and everything from the mouth goes downward, right? We don't want it to go upstream. So we're one big tube, right? Everything that goes here comes eventually out another end. So we're the microbiome of that when you're asking about um, how we evaluate our patients. It's a multiple level evaluation. When we're looking at the teeth, most of the information comes from 3D x-rays and 3D technology. When we can see things in 3D, we can find a lot of hidden infections. And in the biological dentistry world, what that can mean is a root canal that didn't heal well, that's maybe blocking the energy flow to other organs or depleting your immune system in general. That can happen. Hidden, what are called cavitations or covered socket residuum, like old extractions that maybe weren't extracted well. Maybe you had dry socket, and now the blood flow to that area is compromised, and it's led to, again, an energy blockage. We also look at their tongue and to see not just for oral cancer, but as you do in Chinese medicine, I personally am looking for tongue coating, tongue patterns, swollen tongue. It says a lot about their tongue posturing, their breathing, their airway is a big problem with a lot of people as modern orthodontics are collapsing people's arches and their airways. So we look at that. And then I also love to do advanced diagnostics on inflammation. So we do microscope slide testing. So we can test for, I found a tapeworm in someone's saliva. I found trichomonads, spirochetes. It tells me a lot about what's going on in the gut because, again, we're one big tube. And it's just wild to me that I can take a little teeny sample, smear it on the slide, not look like anything's even there, put it under the microscope, and see all these complex things going on.
Is that like normal? Meaning, if I go to any holistic dentist, they're going to go to that extreme of swabbing and looking at my saliva under a microscope to see if there's parasites, or is that something that you've specialized in? Because I know when you and I talk, you have gone above and beyond. You
Yeah.
have an accugraph in your office. I don't know many dentists that actually own and use an integrated accugraph in their office. And so, would you say that you're unique in that way, or like this is common standard for a biological holistic dentist?
I would say I'm unique in that way. In the regard that the more I dive in, the more passionate I become because so many things are uncovered. And having the microscope, we used to just do salivary testing.
Mhm.
And it would show us what pathogens were there, but it wasn't as meaningful as testing in real time and being able to put it on the microscope slide and say, like, wow, your mouth is really sick, or I can see why all these things are compromising your immune system. The other thing, too, is there's just been such a rise since COVID of MCAS, POTS, mold, Lyme, Epstein-Barr. Maybe these things were latent before and then they've been triggered or are overreactive now, but they're really compromising people's immune system. So right now, being able to use some of this testing to see the bridge, it'll literally tell me if someone's positive for Epstein-Barr. I can see harbingers for Lyme, subclinical Lyme. On their 3D scan, I can see if their sinuses are full, and maybe that's what's impacting their brain fog from the mold. It really has, these extra diagnostics have helped me uncover so many connections that I wish it was the standard for all biologic dentists.
Yeah. Yeah. Because it kind of seems like then, like right now, I'm thinking like parasites, being able to see that somebody has parasites, how would that affect their dental health or well-being?
Okay, so what we usually see is massive swollen bleeding gums. So if I put on my traditional hat, I'm just regular dentist here. I just say, "Oh my goodness, Becky, you haven't been flossing. You're overdue, and I'm going to do some scraping, and it's going to be good. And you should do a saltwater rinse or go use toxic Listerine and disrupt your biome even further, and then you're going to be all good." And that became the standard for so long, really because of insurance. It said that you go in every 6 months and we check, and then everyone almost expects that. And so what we see in these bleeding pockets, if you thought about it, if you were brushing your hair and your scalp just broke open and was gushing, you would be like, oh my God, what is wrong?
Mm-hmm.
Or if you woke up and your eyes were swollen and you had all these almost like black eyes, the venous pooling, you would say, what's wrong? But we see it in the mouth all day long. We're just not taught to look at it through this lens. So what we see when I see that, and I also see on people's medical history in combination with that, are gut issues, whether it be that they were told they had IBS, they have leaky gut. And so the combination is what we're calling it is leaky gums. Leaky
Oh,
gums are correlated with leaky gut. They're the same bugs going up and down the tube. So when I see spirochetes, amoeba, trichomonads, white blood cells, macrophages on your slide, that means your mouth is sick and you're fighting a subclinical infection. And if there's a spirochete, there's 60 different types, but if there's even one, there's a ton going on in your gut. So they're coming up the tube essentially.
wow. Okay. So that could be its own podcast. It's just talking about parasites
Yes.
and gum disease in your mouth. So
Yes.
save that. Stay
We'll say
tuned.
that. And I also like to look at their minerals and their hair analysis. And a lot of people,
Oh.
women especially, are deficient on iron and ferritin as we
Mm.
enter this age range. And they're deficient on minerals, magnesium and zinc. So we'll see that as a tongue coating, and we'll also see it as super swollen puffy gums. So it they do tend to correlate, and also you'll tend to build up a lot more tartar because your body's not absorbing the calcium. So then getting back to as we're aging, you're going to have weaker bones, and then
Mm.
we end up on this cycle, and a lot of it shows up in the mouth first.
Yeah, yeah. And so this segues into something I wanted to ask, which is like diet, nutrition, and how important that is. Obviously, if you're eating a diet that is just growing the parasites,
Oh my
that
goodness,
is
yes.
going to affect your dental health. But with like gum disease, let's say, what like does diet and nutrition really affect gum disease? And if it does, like how does that compare with like things like a parasitic infection that's like chronic and low grade? This leaky gum. I love this concept, never heard it. So this is something new for probably many of us.
Oh my goodness. Okay, so diet. To do an overview, right? If someone has leaky gut and it's showing up in their mouth, almost all Americans are deficient in a lot of nutrients. Our food just doesn't have it. It hasn't had it in more than 50 years. So a lot of times we'll start with something simple like trace minerals, but the big
Mm,
issue is that a lot of people in general don't absorb it.
mm,
So there's so much going on in their gut that they're not bringing in these helpful minerals into their system. So yes, we can give people supplements, but a lot of times it's opening up detox and drainage pathways so that the food and nutrition can work. I used to be vegetarian for 17 years, and that ended up being like the worst thing for myself and my gut. I'm very allergic to soy, I'm very allergic to seed oils, and that's all I was consuming. And modern dairy, there's a lot of issues with our foods. So if we can get back to whole foods, whole health, things that are collagen building, like I love making my own bone broths. There's a lot of things we can do in our diets to help supplement our healing and our absorption
mm,
to clear not only the gut issues, but also the mouth issues. But usually it takes a detox
mm.
that someone like you could help with, or a lot of chiropractors, naturopaths, a lot of people are very familiar with opening up the detox pathways
Got
for
it.
people so that they
Got
can absorb better, but get
Yeah.
the junk out of the way first.
So that also segues into the next idea or concept, which is a potential toxin. Let's talk fluoride.
Oh my goodness.
You know,
Yes.
as I grew up, I was told fluoride treatments, fluoride toothpaste, fluoride. When I went into alternative healthcare over 30 years ago, it was like fluoride's bad, all the things. So, shall we talk about that?
Oh yes. Oh
Let's
my
talk
goodness.
fluoride.
It's a heresy. Like it's a heretic. Like you're not allowed to say this to other dentists. Here's the thing. Our cavity rate right now in the United States is the highest it's ever been. So it's not an issue of a lack of fluoride. We're not deficient in fluoride. And fluoride, if you want to get into how we get it from the water sources and Monsanto and all that, we could. The issue is that fluoride in and of itself in a petri dish may be shown to strengthen enamel rods. However, cavities occur because of a disruption in mineral absorption, a disruption in having bad bacteria that have taken over. It's not a fluoride deficiency. It suppresses the pineal gland, and it also suppresses the thyroid. Back before we had some of our modern thyroid medications, we would give high dose fluoride to suppress their thyroid. So it's shown to lower IQ, and also we're being way over fluoridated. People don't realize that they go get their Starbucks black coffee. They might be like, oh, it doesn't even have sugar in it. Well, it has fluoride. They got it from the regular water source. And so the more that we're consuming it throughout the day, we're actually in excess of fluoride. And then we come to the dentist and we give them even more. And we're not supposed to swallow it for a reason. Sorry, my dog's here. We're not supposed to swallow it for a reason. And we're getting so much that we're actually consuming each day. Yeah. So the modern techniques are hydroxyapatite. There's some controversy over the nanohydroxyapatite. So you want to have the right minerals. Hydroxyapatite is essentially what enamel's made from, so that we can absorb it into our teeth.
What's the difference? Like hydroxyapatite and nano, is it just smaller dosage, kind of like a microdose?
So the dental tubules, what the enamel's made out of are these rods, these long tubes. Essentially, I say it's like thousands of drinking straws stacked together if you look at it under a microscope. So bacteria can get in there. What the fluoride and the hydroxyapatite would do is essentially have a particle that would block that tube. So it would decrease the sensitivity, and it would also attract in more calcium and minerals to make the tooth or enamel stronger. Both can do that, but you want to have the right particle size. So when we went into nanohydroxyapatites, people were worried it was crossing the blood-brain barrier. Now, the reality is you would have to consume such a gross excess of it, and we're also not swallowing it. But that being said, if you're worried about that, the microhydroxyapatite and some of the others are much bigger particles. And you want it to be not too big where it can't get in the tubule and block it, and not too small where it's going to be freed up and just float around your whole mouth and be swallowed. So, but hydroxyapatite clinically will help reduce sensitivity and will help remineralize the teeth. That being said, if we have a great oral microbiome, you are not going to get cavities.
Wow. I just learned even more about hydroxyapatite and the difference between hydroxyapatite, nanohydroxyapatite, microhydroxyapatite, and I love your visual of those little drinking straws, and that the molecule needs to be small enough to block to be effective. Thank you for that. I'm sure this is
and I can recommend some great. I'm lucky and blessed that I've made some friends in my biologic community who've formulated a lot of these products. So I know that they're safe. I can tell you where they source it from, but also which ones are safe and effective. Yeah. There's quite a few brands I can recommend.
I will get that. I will get that after this and include it with our show notes.
Yeah. And then we're going to talk about mercury, the other big toxin.
That's what I wanted to talk about. Toxin number 2, mercury. Thoughts?
Yes. So mercury, and we use a lot of heavy metals in dentistry. So it's not just the silver fillings. Now, what got me into this holistic path is I was mercury toxic. And I am someone who's never had a mercury filling, and I have the genetics of my MTHFR. So I don't methylate, I don't detox well. And so just from being around it in dentistry, breathing all this stuff, I built up a lot of toxins, and I was mercury toxic. And it led to a lot of issues, a lot of gut issues. So I've gone through layers and layers of gut detox and liver detox and chelation. And anyway, it's really impactful with just being around it that I could be affected by it. So for all the naysayers, it now is published by the American Dental Association that it is not recommended, and that some people may be affected by the toxins of mercury. The reality is the mercury fillings are more than 59% mercury. We call them silver because they're silver in color, but silver content is less than 9%. So we're putting these in our teeth, and what happens is the saliva is a major conductor, right? So all this electricity is running through it, and as the teeth are not only being chewed on, but the expansion and contraction of cyclical cold, hot, chewing is causing them to expand and contract, which can, 1, crack the teeth over time, and 2, will lead to a lot of the mercury being off-gassed. So The other part, as a dentist, we learn about something called creep, which essentially is the corrosion of these. So they start to look under our magnification as really coppery in color. And so what that means is that's their peak state, most releasing all the mercury at that point in time, because now they're essentially corroding and rusting in the mouth. So,
Ugh.
whether or not you believe it is affecting you, it definitely isn't good for you to have all those in there. So it's important, though, that you find a provider who removes them safely, because it's worse to have the fillings removed unsafely than it is to leave them alone. But then there's a lot of people I know right now who are seeking, they're in a lot of mitochondrial fatigue. They feel like not themselves, they're tired. Their overall wellness is very low. So they're looking at these biohacking things. And some people are like, I'm going to go to a functional medicine doctor and I want to be detoxed. But you can't detox someone if all this is in the mouth. You're drawing more into the system while the actual source is still there. So it's important that you know and find someone who can put all those pieces together for you.
Right. And also educate you so you understand the bigger picture. Hence the reason for this podcast, because many of us are inundated on social media, Instagram, on things like the hydroxyapatite toothpaste, on removing your mercury fillings. That's what happened to me in Chinese medical school. That was a big thing. Everybody's like, you got to get the mercury out of your mouth. You got to get the mercury out of your mouth. So I just went and got the mercury out of my mouth, but I
Yeah.
didn't do it like groundedly, like the way we're discussing.
Yeah.
I did get, I think, what do they use? Amalgam fillings now. Do those
Yeah.
also expand and contract over
Oh,
time?
so we use composite now.
Oh,
It's a
composite.
fancy
Okay.
plastic. They do. They're very technique sensitive. So the other thing too is a lot of them, if you go to a traditional dentist, a lot of them are made with BPA cascades. So if you're someone who's worried about plastics and microplastics, you should be careful, because those of us who are holistically trained use materials that are BPA and fluoride free.
Yeah.
A lot of them have fluoride releasing in them. And so it's important that your dentist be aware of that. It was really a shift, especially since I'm so old in this profession. White fillings were somewhat new when I was first out. And it was like, ooh, that silver fillings are black and this one's white. But we still should be looking at what's inside of it, because they do expand and contract. They flex more with the tooth, but you still are essentially swallowing something that's chemically made if you're not careful about which materials are chosen for you.
Yeah, well, I had these replaced in the late 90s.
Yeah.
So I'm pretty sure I got that early material.
Yeah.
Because my fillings were rather large, the replacement created such big cracks in my teeth. I ended up having to have some crowns and then a root canal. So
Yeah.
that's the next thing I'd love to talk about is your approach, your position on another controversial topic in dentistry when we look at it holistically and conventionally, the good old root canal.
Yeah.
I think
Okay. I have lots to say on that. We're going to
that
have
could be
a
another
five-part
podcast.
series. A five-part series. So, with traditional holistic biologic, we have a saying: if it's metal or dead, get it out of your head. So there is a whole thing about having the toxins that can be released from root canals. And a lot of it stems back to the Price Pottinger studies and also Dr. Thomas Levy. They've had some studies that were done that were saying that almost every person who had cancer ended up having root canals also. And every person who had heart attacks had at least one root canal. So there's a lot of correlation between those, whether or not it's empirical data or just an observation. They made these observations. And so a lot of times people were told that root canals are horrendously bad. With modern technology, if you had a tooth that died, like you were hit in the mouth with a baseball and now you have your nerve there, if the endodontist used lasers and ozone, there's some that do, and 3D technology, and properly filled the canal in a really conservative way, it may not be as harmful for you. But the way that I was trained and the way that they're still trained in dental school is the 3D technology isn't the standard still.
Mm.
It's like the ideal, but the standard of care is essentially we take these little metal files, we remount the inside of the tooth, soak it in bleach, and fill it with rubber. So the biggest issue with that over time is, again, using the drinking straws analogy, is we have these areas where the main canal is treated with the rubber material and the bleach, but it never reaches inside of all those drinking straws. So you end up with a lot of bacteria that's trapped inside, which is anaerobic and it thrives. So literally, the tooth is no longer hurting you. We've removed now the lymphatic supply and the nerve, and you can have something, as you know, that could be brewing a long time. And if you are really optimally healthy, your body can actually fight it off.
Mm-hmm.
But it just takes something tipping the scales. And
Mm-hmm.
that's why I brought up the whole COVID changing a lot of this, is maybe you had the sickness, maybe you had the 10 vaccines. I don't know, but you could have something that now disrupted everything. And now something that wasn't bothering you, if your immune system gets depleted, now it's overwhelming, and
Mm-hmm.
something that wasn't a problem can become a problem.
Mm-hmm.
So what we see on a lot of these root canals is that they're essentially poorly done.
Mm-hmm.
And there's bacteria that's left inside. And I can tell you, I take a lot of pictures, and I also do microscope testing when I take them out. And my goodness, they're black, they're gangrenous. We have the little metal file sticking out the end. And sometimes they actually look clinically acceptable as a general dentist on the x-ray. So you can have these hidden infections. I see a lot of them that really make someone's sinuses so full that they're not breathing well, they're not sleeping at night. All that bacteria is just sitting there, and it depletes their immune system and their energy. So we can see it manifest in a lot of ways that is not a toothache. It's
Yeah.
not, oh, this hurts and I know something's wrong. Sometimes
Yeah.
it is. So to get to your answer with the root
Yeah.
canal, you really want me to go on a tangent. I'll later talk about how much they're overprescribed. You have a filling that's done, maybe the sensitive, maybe the filling was in place perfectly, and now, oh, let's kill the tooth. The pain will go away. Now you have a root canal that can harbor bacteria. Now you need a crown, and now you're on the dental treadmill of needing more work and introducing more things that are not natural to your body.
Yeah, you're going to
So,
need a new crown on
yep,
that root canal, and then you're going to need a retreat from time to
yep,
time on the
yep,
root canal. And then one day you're going to wake up right before a big speaking event, and your face is going to be like a balloon, and you're going to have an emergency tooth extraction. I'm just speaking for a friend here
yeah,
that, like treated a improperly done root canal and retreat and saved it for about 15 years
yeah, yeah,
until, like you said, it just was like the day. But that's for another podcast.
yes. And actually, speaking of that too, though, getting into the holistic, the whole person, and I know you and I are both equally passionate about this, but
Yeah.
there's also the trauma component. One of what we hold in our teeth, the emotions and the emotional centers. And that's what I love about the accugraph, is it shows the connection of where we're holding our tension. If you really want to get out there, like if your sacral plexus, solar plexus, whatever, you could talk about, there's a lot of emotion we hold in our teeth. And sometimes that can lead to us feeling even more affected if we lose a tooth. Some people feel very out of sorts. We hold a lot of mom and dad trauma, depending on which side of the mouth that we're talking about in our teeth, believe it or not. So there's a whole nother component to that I find
Wow.
fascinating about how a tooth can affect your overall well-being.
Well, let's
But
let's talk about that just a little bit because many people listening are in healthcare. They're
okay.
either natural, alternative, healthcare, acupuncturists, chiros. Like, what would be some flags
Hmm.
that they would see? A patient would come in, and what would be some signs and symptoms of what you're talking about?
Um,
Let's start with emotions. Like this is a sign or a symptom that somebody is carrying old emotions, unworked through emotions in their mouth.
okay, so anxiety,
Yeah.
severe anxiety
How
that's
does this
getting
show up
worse.
in the mouth?
Okay, I'll tell you a story,
Okay.
but severe anxiety. brain fog, forgetfulness, lack of energy. Usually there's an excessive weight gain that's unknown, meaning like, oh my gosh, in the past year I put on 30 pounds and I just can't lose it. Those are some big ones. Bloating. So just talking about, we're looking at the external being,
Yep.
nothing going on dentally.
Right.
So my dental hygienist, when we're going into trauma, had her tooth hit when she was 9 years old. She's now in her 30s. Her mother and her sister are dentists, but she only trusts me, which is great. So she actually had to take a leave of absence because her anxiety was so bad. And she was going through all this therapy and whatnot. And it was getting worse and worse and worse. She gained weight, whatnot. And one day when we were practicing our microscope slides on each other, she's like, I feel really off. I'm going to test myself. And we found a lot of spirochetes. And her mouth is pristine. I mean, literally, you can't even find tartar to clean off. And I said, instinctively, there's more going on. I just feel that we should take a 3D x-ray on you. We did. Her front tooth, I have a regular x-ray, looked perfect. On her 3D x-ray, she had an infection the size of my thumb. I'm not kidding. All the bone was gone. And so we scheduled her for a surgical procedure to clean that out under sedation. She had the trauma release, all the stuff she had been holding up with whatever happened when she was 9, and then her mom overlooking it and her sister overlooking it, and then all the stuff. She cried for 3 days straight. She was a mess during the sedation, and I knew what it was. It was a trauma release. I'm like, let it out. She came in Monday morning like a whole brand new person. She has not had any anxiety since. Her gut issues went away. She lost the 30 pounds in the past couple months without doing anything different. And it's just, it goes to show, and she has no spirochetes now when we retested her, but it goes to show that not only the trauma, but the infection had been burdening her so long, and she never had a toothache. She never had a gum pimple, a fistula, nothing. And so she did her story on our website because I found it fascinating how it, under my own nose, under her own nose, meaning like the infection was right here.
Yeah.
Neither one of us knew this was going on, and how it manifested was in her emotions.
Wow. And the 3D imaging is what found it, revealed it, and 3D imaging is typically only done from a biological dentist, holistic dentist.
Yeah, actually, you can
Amazing.
have it done a lot of places. You can have it done at your oral surgeon. You can have it done at an endodontist. You can have it done at an imaging center. You just have to have someone who knows how to read it.
Right. And to see that infection or even to think that way, because like you said, most people would say, oh, you're having anxiety. Let's go to more therapy. I mean, like, honestly, this is why I
And
love,
medications.
I know,
And
this is
medications
why
too.
you and I love talking about this stuff
Yeah.
because there's a lot of people now embrace somatic healing
Yes.
using, somatic therapy and to apply that to even dentistry and recognize even further that our macrocosm contains microcosms
Yes.
within it, and you can treat the mouth to treat the whole body, like auricular acupuncture. The ear is a map of the whole body. It has been clinically proven through fMRIs that I can go to your brain and put an fMRI on there. I can poke your knee and your brain will light up knee. The part of your brain associated with your knee will light up. I can go to the part of your ear map that is associated with the knee. I can put a needle there, and the same part of your brain under an fMRI will light up. So I think this is why I
So
get so
fascinating.
excited because there are so many ways to go about evolving, growing, moving through life's challenges and growth opportunities. Some people call them trauma, call it what you are. But if it's holding you back from living your best life, let's try something. And perhaps if this podcast might be somebody's light bulb going off, like, I haven't tried my oral health or organic dentistry to see if that could be where my breakthrough occurs.
Yeah, no, absolutely. Absolutely. And like I said, it's just the more that I've discovered some of these things, it's really renewing my faith and my focus on just like how powerful this can be with the right provider.
Mm-hmm.
So it can be difficult to find. People find it more expensive because most holistic dentists do not
Mm-hmm.
take insurance.
Mm-hmm.
But half of that is because it takes a lot more time to be able to unravel these issues and a lot more expensive equipment. I have a lot of, as you know, you've been to my
I
office,
know.
3D technology, lasers, blood spinning machines, ozone machines. I have ozone machines in every operatory, the microscopes. I have a lot of extra things that we do to get our patients better. But the best dentistry is no dentistry. So if we can get people to a state of health and restore things in a really conservative way that helps preserve their natural teeth for as long as possible, that really can allow their body to function optimally.
I love that. Let's talk about some of your equipment. Just so, number one, I think we've identified asking for a 3D image and having
Yes.
somebody that can actually read that for you in an impactful way, a holistic way, is
Mm-hmm.
helpful. But what other things? Like I know you have the ozone, you do blood spinning, and then you'll do PRP, and you'll put that person's blood back in to unhealthy area, like if you're doing surgery.
Mm-hmm.
Can you just give everybody listening
Yeah.
an idea
A
of what you
basic
offer?
overview.
Yeah,
Yeah.
I'd love that.
So oh gosh, it's hard to choose my favorites. But so the 3D is one, and it
Yep.
took a lot of time and training. If a dentist wasn't trained, they could still have it read by an oral maxillofacial radiologist who would also help identify on the slices where we can see some of these infections. The second is ozone. I use it. I've used it every day on almost every procedure for like more than 15 years. We use it in the ears or in the nose zone for sinus issues. We can use it for TMJ issues, but it's great for getting through the ear canal into the sinuses. I use it chair side when we're doing our dental cleanings. We use it in all of our water, and we also, any infected pockets, we'll put ozone gas in the pocket.
Mm,
It'll kill everything. I mean, anything bad, I should say.
got it.
And it really stimulates good blood flow, and it's essentially a free radical oxygen that's released.
Love
So
it.
that free radical oxygen will kill off any anaerobic bacteria, spirochetes, parasites, but it also will help stimulate your blood and other areas to upregulate your healing. So
Mm,
I also use it during deep fillings. I use it when I'm cleaning out an infection in a surgical site. I use it chair side and actually scrub the area. Um, mentioning my centrifuges. So I have two. We do draw your blood and we spin it and we mix it with, if you're having a bone graft, we mix it with hydroxyapatite actually and tricalcium phosphate to make a natural bone graft using your own white blood cells and fibrin and all these other growth factors to plug the socket versus something artificial, or usually we'll use cadaver or cow in traditional dentistry. That's the most common. And I can get into that later, but and then my other favorite thing is my microscope. I love looking at the salivary diagnostics of stuff because it's just I did not know you could see a tapeworm on these slides. I didn't think you'd even have them there. So I do love that. And then I also love some other special equipment. I have my laser, my erbium laser, which I use for treating infections, upregulating healing like photobiomodulation. It's a really high wavelength red light on certain settings. I also can use it for facial aesthetics, but I really only do that on myself.
and
We
friends.
can, yeah, but it's a great laser. I really love it for that, and I also love it for stimulating, healing, and disinfecting pockets. We have a lot of different settings we can use for that. I use it also with instead of drilling on some deeper areas
Mm,
or on conservative areas. It's a lot less traumatic to the tooth, and it's also you barely need any numbing for it. And then I also have air abrasion and biofilm therapy. So essentially, it's like I can put it on a power wash setting for when we're cleaning your teeth, and we use an alkaline powder to essentially flush the pockets and polish the teeth. That helps also reduce bacteria. And I have it in a setting I can use it instead of drilling. So if I'm drilling near a nerve or a fracture, it's not jarring to the tooth. It won't overheat the tooth. So in my view, it's very helpful in conservatively treating the area in a way that doesn't kill the tooth later. If we overheat the nerve, drill too deep, make the fracture worse by drilling on it. And so I think it gives a lot more longevity to the restorations and to the teeth.
I love that. I love that. Okay. Since we're
Oh, and
getting
IV therapy.
in
I'm into
IV
IV
therapy.
therapy now too. The nutrients we can, there's a lot I love for that, for guiding healing for people, especially if they're having something done surgically or they
Yeah.
need to be detoxed.
Yeah. And I know I've been to your office. You have like sweet teas there, not sweet in terms of sugary, but like calming teas, and you have
Yeah.
aromatherapy, and you just
And
have
flower essences. Yeah.
flower essences.
Sound bowls.
Like when I say holistic, my friends, this is like holistic. And
Yeah.
so not everybody can come see you in
Mhm.
Encinitas, but what would be like 5 recommendations you would give people to optimize oral health?
One, switch to more natural products. For instance, you should use Listerine only to clean your toilet.
Thank
It
you.
it is such a it is so killing of not only the good bacteria, but also the nitric oxide in your tongue, which helps with there's a lot of benefits to having nitric oxide increased in terms of sleeping and your microbiome. So I wouldn't use that or any of the products that have like triclosan in it. Essentially, that's stuff in hand sanitizer. Um, your toothbrush can really matter. There's a lot of studies now. They even switch Glide floss, the Teflon coated floss. I used to love that stuff.
Yeah.
They switched the formulation because it was releasing so much plastic. So essentially shoving in our gums, and then we're rubbing plastic into a bleeding area, which goes in. That plus some of the toothbrush bristles are making it even worse. And over time in our toxic environment, drinking out of plastic water bottles and all that, that does have a compounding effect. I mean, so
So
there's
what kind
there's
of
those.
what's the best toothbrush then? Like, is it electric toothbrush, non-electric, the bark toothbrush? Like,
It
what is
can,
it?
yeah, I know.
What do
There's
we
so many different
do?
ones. It can depend on the person, but essentially I wouldn't use anything that's overly harsh. I mean, you can see the thick, gross plastic bristles. Some of them feel like you should be scrubbing grout with it versus gently sweeping your teeth. So there's quite a few brands out there that are really, really extra soft and gentle. You could use the bamboo ones as well. I don't love all of those as much. Some people love the water flosser. There's a lot of things we can incorporate that will help. And then in terms of like at home products, some people love oil pulling. It's great. I personally wasn't able to do it the whole 20 minutes. You could try something like that, or there's other natural products. A lot of offices stock them for helping reestablish a good oral microbiome. I use a lot of those products. You can use oral probiotics also, so that if you did have bad bacteria, you can have the good bacteria rebuild. They're different than the gut probiotics.
Mhm.
So those are some things you could start with at home. In addition to, I mean, a healthier lifestyle in general is going to be what gives us the most longevity in life in general, right?
Like some people use tea tree oil in their mouth or baking soda
Mm-hmm.
or
Those
hydrogen
bacon, yeah,
peroxide. Are those any good?
yeah. And you know what? There's some people who even put a drop of bleach in their water pick. The baking soda is alkalinizing. It can be too abrasive depending on how you use it.
Hmm.
There's neem, tea tree oil, all those
Hmm.
things are great, but it
Hmm.
depends again on the formulation. So
Hmm.
I had a recipe on my website a while ago for making your own toothpaste, but a lot of the natural ones have a good balance of the elements in it. Any of the antimicrobial oils like oregano oil, tea tree oil, clove, there's a lot of them that have benefits. Frankincense even is great, but again, it depends on how much you're using. And some of the oils are hot and you can't put it directly in your mouth. You would have to have it mixed with something.
Yeah. Wow. This is so good. I like we've said when we started and we've said
We're
several
going to
times,
talk all
like
day.
we could talk all day. And I think, I would love to have you come back on and we focus on one of these things because these are all hot topics that a lot of people are out there, especially moms. You and I are both moms of kids.
Yeah.
And we want to do the best for our kids and for ourselves and be the best version of ourselves. You're both of us are committed to that and more so committed to helping others. And that's what I really hope that we've done in
Yes.
this short time together. You have such a fun social media presence. What is your Instagram so that people can come and start watching your fun videos? Because I'm sure you're dropping nuggets like this on the daily that people can get to. So, what is your
Oh,
Instagram?
it's at Nicole Vane Dentist. So my
Okay.
name at Nicole Vane Dentist. My office is called Moonlight Beach Dental.
Yeah.
And if someone was looking for a holistic dentist, there's a vetted site called Aura Biologics where
Okay.
someone could also look up and see which providers may be in their area that offer a lot of the services we're talking about. So Aura Biologics, yes. And
Aura or oral?
Aura, ORA
Okay.
Biologics.
Okay.
Yeah.
Okay. Okay. I'll add all this to the notes,
Hmm.
including also the toothpaste recommendations with the nano
Yeah.
hydroxyapatites. Also, Parasite, you introduced me to the Worm Queen. I think she would be a great addition to the show
Yes.
notes in terms of anybody who's like, oh, find somebody
Doing
to
a light
test
metal
them for
detox. Yes.
parasites. Yeah, because she
Yeah.
has some great options there.
Really good home kits, yeah, that people can use.
Yep.
And then if anyone has any other questions, they can reach out to me personally. I check all the messages.
Very
Um,
kind.
yeah, I do all the posting. So
Wow.
I have a eye on everything. So if anyone wants to get in touch with me directly, it's very easy to do so.
Is the Facebook the same as the Instagram?
Yes,
Okay. And then YouTube. Do you have a YouTube channel? Sorry, I
I
didn't know that.
do. Nicole Vane.
Okay. Nicole Vane.
Nicole Vane and Moonlight Beach Dental. Yeah, I have I have hundreds of videos actually.
Okay. I love that. My friends, you heard it here, and you're going to hear more because we will be back. And I just want to thank you again, my friend, and I'll see you tonight for football.
Yes, this is so fun. I could talk to you all day
Yeah,
long. I
and
love
we
your
will.
company.
Okay. Thanks, hon. Happy Friday.
Thank you to you as well.